She has a big heart, big wings, and a big commitment to restoring the magic to communities. Welcome to the Fairy Godmother Show.
So this is sort of just a little bit to the left, which is this person is who wrote this. I don't know who it is because I don't remember, but I thought it was very interesting. They are definitely ready to get out of the house. So their question was, can I travel without being vaccinated? And is it safe to fly if they are not vaccinated?
Yeah, so the short answer is yes. There's no vaccine mandate to travel. What I will say is that if you're traveling to another state or another country for that matter, you should just check and see if that state has restrictions in place. So New York, for example, if you're traveling into New York, you're supposed to quarantine for a short time. And so each state has different rules and regulations. Some are a lot looser than others. Some are a lot stricter. But there's nothing that prevents you from traveling without a vaccine. The short answer to that is no. And is it safe to fly? Look, that's everyone needs to make a sort of a personal decision and judgment on that. From the science that I've seen, airplanes are quite safe. They have highly effective ventilation systems. If it were me, I would, and I have not traveled by plane since the pandemic, admittedly, but if I was, there are some airlines that are still honoring the every other seat policy and keeping empty seats in between people. Some airlines are not honoring that anymore. So that may be a consideration if you do want to fly and look out for those airlines that do have some additional space in between passengers. But the science I've seen shows that the planes are quite safe. And the most dangerous, or I shouldn't say dangerous, the highest risk component of air travel is in the airports. So that's where you want to be most careful.
Thank you. Okay. So what kind of community education is underway to help convince the reluctant to take the vaccine?
That's a great question. And what we've known for a while, and certainly what we've seen, is that communities of color and households of color have a higher vaccine refusal or hesitancy rate than other households and predominantly white communities. I think a large part of that is historic in nature, in the sense that, or historical, I should say, in nature, in the sense that in some communities, there's been a mistrust that's developed between people and the medical community and we need to repair that trust. In a community like Newburgh, we have to do a lot of education. It saddens me and it really frustrates me that among nurses, which are disproportionately women and people of color, nurses have a really significant vaccine refusal rate. And these are people who see firsthand what this virus does to people. These are professionals that have seen people die in front of their eyes. And there is still that vaccine hesitancy. And so we have to do a lot of education. The state is putting a pretty robust amount of money behind an educational campaign. And some of this falls to us, right? I'm a local leader. You all are community members, and you have neighbors, and you have your social circles, and we all have to do whatever we possibly can to instill confidence in the safety of these vaccines, because they are safe, they're backed by science, and really, this is the only way we get out of the pandemic, is if people get the vaccine.
So the next question actually is pretty much very close to what you just talked about, but specifically about the Hispanic population. And I'm going to just jump and just say that I'm certain that a lot of the educational materials that's going to be coming out will be translated into Spanish, because that
Yep.
is, a big question about the Hispanic community.
100%. The answer is yes. And the state, and look, not to suggest the state can't and shouldn't be doing more, because we should, but the state does have a task force, a committee set up specific to this issue. There's been outreach to the faith-based community because obviously, congregations, they look to their religious leadership for guidance. And we're trying to reach out to whoever has trust in communities that may have vaccine hesitancy. And so the short answer is yes, absolutely. The material has and will continue to be translated.
Okay. So I'm just going to throw the extra in there, which is, as an African-American woman, it pains me about the level of trust that I'm going to say my people don't have in the community, with good cause oftentimes, but it's really a sad thing when you see someone who is African American, a woman, and a nurse, and I know many of them, who refuse to actually take the vaccine. And so it's interesting that you actually brought that up, because, like, wow, you've been on the front line, you've seen it, so wow. Wow.
Yeah, look, and I know St. Luke's Cornwall Hospital, I should say Montefiore, St. Luke's Cornwall, they have worked very hard to educate their staff, their team, because it's very sad to see and frustrating to see people with concerns about the vaccine. And I know the hospital, we talk about all these ways we're trying to educate one another. I know the hospital has worked very hard to try and to get their nurses and their entire team, right down to the security folks, on board with getting the vaccine.
Well, I'm just gonna throw my commercial in there, which is one of the things that I decided to do is I wanted to do my part to help, because I know a lot of people who are first responders, and all the fact that they actually put their lives on the line, and their families, the risk of taking something home with them as well, is a big thing. And so I decided to do my part, which was create these Magic Feet compression socks that we're going to actually be giving out to first responders. And so you'll hear more about this. And James, I actually want to talk to you a little bit about that, because I actually want to see if you can help me identify some agencies and organizations that are actually working to help keep people safe, so that we can actually get them some of these compression socks to make their jobs a little bit easier, comfortable, as they go in their day-to-day.
That sounds great.
So, all right, so next question, we've got both Pfizer and Moderna claim their vaccines are effective against the United Kingdom, the UK variant and the South African variant. They're working on a third booster because they're not as effective against the South African variant. What steps are being taken to ensure that the other variants are addressed in a timely fashion?
So I can just tell you what the scientists tell us, and that is, we should expect other variants. And so there are a lot of attention to the UK variant. The UK basically shut down again after identifying this new variant, and the biggest repercussion of the UK variant is that it has a far higher level rate of transmission. It's much easier to catch and spread the UK variant than what I'll call sort of the standard COVID-19 virus that we've been dealing with. And the South African variant, which is in this country now, it has shown more resistance to the vaccines. And so now, not to suggest that it is completely resistant, because it's not. The vaccines are still effective, but they're not quite as effective as against the original and the UK variant. So yes, I know they're working on some boosters to try and address this, but I think the point I'm trying to make is there's almost definitely going to be more of this. So, that's why we need to get to herd immunity. It's almost like a race against time here. We want to get herd immunity before we get all these additional new, potentially more dangerous variants here that cause havoc. And, even if, the efficacy rate is maybe not, 95%, but it's 80% against some of these variants. If 80% of Americans have that 80% immunity, that's what herd immunity is, and that's how you stop these things in its tracks. So that's why we're trying to get these rolled out as quickly as possible. One of the reasons is because we're racing against these variants.
Thank you. Okay, so next question. The person said, I had an adverse reaction to the flu shot and and I'm assuming it's A, not particular this one. So I've had an adverse reaction to the flu shot in the past. So I'm waiting for some research and data before I take the COVID vaccine. Is it true that pharmaceutical companies are not liable if someone has an adverse reaction to the vaccine, causing them to lose work, go into the hospital, or even die?
Yeah. So I don't know every detail about this policy, but the short answer is yes. The federal government many years ago passed a law, and I don't know what the context of this was or why they did it, but they passed a law many years ago that provided legal immunity to the vaccine manufacturers when an individual is seeking to bring suit for some sort of damage. There is a specialized, basically vaccine court that the federal government has set up to hear cases from people who want to bring a lawsuit, and so that's basically the information that I know. Now look, there are some individuals who do develop, for example, allergic reactions to vaccines, and that exists. It's a very tiny percentage of people, but it happens. And furthermore, there are some types of people who should not get vaccines. If you are severely immunocompromised and your doctor advises against getting vaccines, you should not get a vaccine. If for example, in New York, we have what's called a medical exemption for children to attend schools. They can seek a medical exemption from their doctor and approved by the state if their doctor tests that the child cannot get the required vaccines because they have a compromised immune system. For example, if they're undergoing childhood cancer treatment, chemotherapy, they cannot get vaccines because their immune system is so compromised. So there are types of people who should not be getting vaccines. It is a very small percentage of people, but you should consult your doctor, medical professional, if you do have concerns. But make no mistake, for the overwhelming, the vast majority of people, vaccines are completely safe. Yes, you might get a very mild side effect of some pain in your arm or a very mild, day or two fever, but that's it.
Okay. Actually, I know someone who just had a massive dose of chemo and her immune system was totally destroyed from the chemo. That was the point of it. She had cancer. And so her body is at the immune of a 3-month-old. So she can't, all of the vaccines that we actually got as children, she actually has to wait almost a year to actually get those redone because they were all wiped out from the chemo. So this is something else that she can't take right now either. So, I completely get that. All right, so we are going to get a little bit more, we're going to narrow down a little bit, right? And get a little bit closer to the Newburgh area. Now, when you came on, we were talking about the fiasco that happened at the Armory. And so one of the questions was, and I don't even know if you can answer this question or if there is an answer for this question. I guess the key here is that how do we make sure, for me, it's how do we make sure that this does not happen again? So this was the question that was posed. Mayor Harvey just announced that the vaccine for Saturday at the Armory. Do you have the information? Who can get it? What are the times? And if you need an appointment, how, what's the number for that? And then the next sort of similar question was from someone else that they actually gave out 50 vaccines at the Armory, and that they were all gone because people had pre-registered for them and nobody in the city actually knew about it. So if you could just address that. I don't really know how you can address that because it's already
Sure. So the governor announced a number of, he's calling them pop-up sites. These are basically 1 day or 2 day vaccine centers throughout the state. So this was one of those pop-up sites. There were a whole number in New York City. There were some further upstate. I think a couple on Long Island, and they were targeted to underserved communities of color. And my understanding, I wasn't involved in the process that set this up,
Right.
but my understanding is that the state, through this task force I mentioned before, basically reached out to the faith-based leaders in Newburgh, perhaps among some others, to get the word out about getting appointments for this 1 day pop-up site in Newburgh. And so that's why I believe there wasn't basically some open registration, and that's why you had all these pre-registrations, is because that's what exactly was done in advance of setting up this site. Was, you had church leaders and others who basically directed their congregations and other folks in their circles to this pop-up and got them on the list. And so this was, if nothing else, a failure by the state to effectively communicate what was going on. Much of this problem was the fact that there was confusion about what was going on and false expectations, and people just not understanding what was happening. I will also say that, and so there are 250 vaccines that were administered that day, and that's a pittance. It's a pittance. If we're actually going to try and provide a real demonstration of effort here in underserved communities of color, it ought to be a lot more than 250 shots. So my team and I, we have 3 times a week calls with the governor's office, evenings, 3 times a week about COVID issues. And we are constantly bringing up the fact that a pop-up site's wonderful, but let's keep it here for a week and do 250 shots a day for an entire week, not 250 shots for 1 day, and no one in the general public can really get access because all the slots are taken before they even know about it. So we're constantly pushing, but that's what happened at the Armory.
Okay. All right. Well, thank you for that. I'd rather have some sort of clarification on what happened, because I know it was a big hoopla, and it was just something that a lot of people were talking about, rightfully so, upset. And you know how people are, they kind of make it up as they go along, and next thing you know, it's like, oh, people were coming from other states. I heard all kinds of stuff. So I'm happy that you actually shed some light on it.
Thank you for joining us. We can't wait to see you next time right here on the Ferry Godmother Show, where we are restoring the magic to life and play.